I'm a physician. I'm an internist. I've been in Miami a long time.
What's the best way to take Ozempic without dealing with the side effects?
I'm all about making things better, right? I think that in every way, right? Like physically, mentally, sexually, emotionally.
I also heard that you do injections.
I do.
And I had no idea that you can actually inject the penis to make it bigger.
You can inject a lot of stuff.
Partners having sex and like something goes wrong.
They were using a large vegetable.
Wait, which vegetable?
It was, if I remember, because there's been a lot of vegetables over the years.
What is it with the vegetables?
I don't know. Somehow they're kind of phallic. People think, well, maybe this one will work.
Did you see Lindsay Lohan's new face?
I did.
Everyone's like, she did a facelift or like she did something completely new. What are your thoughts on that?
So, first of all, I would say...
Let's talk about asses.
Uh-huh.
Okay, so you can do a BBL that sometimes, I mean, most of the time in Miami, I'm like, this looks horribly done. Mm-hmm. Or you can also inject. Mm-hmm. Would you say injection is more natural but costs more? Like, what's the vibe on that?
It'll run you easily like a good 3, 4, 5 grand per session.
And how long do you got it? Like, how many times do you have to be back in your office?
You're listening to the X Podcast. The X you keep coming back to.
Hey guys, welcome back to the X Podcast. It's your host, Alessia, every single Monday. Today, I have a very special guest. I don't want to mess up his name. Thierry.
Bam. Nicely done.
Yes. Well, I mean, it's a French name. I got to get it right. Welcome.
Thank you.
Do you want to tell everyone a little bit about who you are, what you do? I feel like you're a little bit of everything.
I do a little bit of everything. I'm a physician. I'm an internist. I've been in Miami a long time. I grew up, I'm from a French family, but born and raised in Brazil. So I got a lot of cultural stuff going on. Came to Miami when I was in my teens, not knowing if it was going to be, for like a day, for a week, for a month, for a year. And then many years later, we've stayed here. So I studied here, I've stayed here, and so on. Earlier part of my career, I worked in a really busy emergency department. I was an emergency physician. Transitioned, gotta be careful with that word these days, but how else could I say that? You know what I mean? Over a few years, as I decided to build my clinics, I decided I wanted, more control over what I did and ultimately work with a different population that was more motivated to be better and perform better in all ways. And then so I let my ER back life go after a good 10 years of that. And now I have, my own clinic where we focus on performance, wellness, beauty, anti-aging, all that good stuff.
Okay. Well, we need to talk about ER because it's giving Grey's Anatomy. And I just need to know what your most insane story is.
There are many stories. There's, probably some that I've forgotten. There's a vault with the really painful ones. Because, when you work in the emergency room, you see everything from the most tragic to the most ridiculous, and everything in between. And sometimes it's rapid cycling, right? So you don't even have time to, most of the time, in fact, if you work in a busy place, which I did, you don't even really have time to process one to the other, right? So you go from trying not to shed a tear to next second, wow, that's silly, to something in between to, wow, this person's legitimately sick, and then you just keep somehow, some way, trying to find ways to cope with all that, right?
Never a dull moment.
Never a dull moment. So the classic ones were always the group of people that would pull up in a car right in front of the ambulance bay and just dump some half-dead person and run away. And then you have no story, no backdrop, no this, no that. It's well, did they get shot? Did they OD? Did they... It happened all the time. All the time.
Oh my God, that's insane! Like the movies.
For sure. It's not a. People think, it's for the show or for the. No, it's a thing.
And also, we're living in Miami, so.
For sure, exactly. Where no fuckery happens here, God forbid, right? Then you have the classic stories of people that get shot, And then the story is always the same. Like I was minding my business and some dude just pulled up, and which I get sometimes can happen.
Yeah.
But in general,
You're getting shot
dude,
for a reason.
Yeah,
normally.
in general, that's some dude. He's involved somehow, some way. You know what I mean? So that happens a lot. Then you have, the classic ones that people sign into triage. They walk in, they sign their name, and they just collapse and they die. And now you have to yank them in and try to figure out what the hell happened. Is it their heart? Is it that this and there's that? You're constantly in that state of what's next, what's next, what's next, what's next,
Yeah.
what's next, you know? So there's a lot of that. I saw a lot of all that stuff over a lot of years.
What about like sexually, like partners having sex and like something goes wrong?
All right, so I'll give you one ridiculous one, and I'll give you one that could have been really tragic. We had a couple one time that showed up, and young couple, and the girl couldn't understand why she was so nauseous. We're like, I've been really nauseous for a few days. And we're all like, well, there's probably one really good reason.
Are
why
you
I'm so
pregnant?
nauseous. Right, probably pregnant. And so, we did a quick test, whatever. So like, you're pregnant. They both look like, they gave you the look like, how is this possible? Like, I can explain it to you if you like, but and then we start to ask some questions. I don't know how it came about, but we start to ask some questions, and they were like, well, we don't understand. We've been using Plan B. I'm like, well, that's interesting. So, me being, a curious fellow, I was like, okay, well, let's go back to this Plan B situation. And then
Wait, what do you mean we've been using Plan B?
Exactly.
Like it's like a pill they pop each time like he comes inside her?
It gets worse. Yeah, so Plan B theoretically, right? Like you have a window of a couple of days after where, if you've had unprotected sex, you can...
And it's still not
like
100%.
It's not 100%, but it's even less than that when they do it the way they did it. So turns out that the way they were using Plan B was that he was using the pill before they had sex. So he thought somehow by using a massive amount of birth control for women that he was going to be infertile every time they had sex. So now you have this information, you're trying to laugh, but you also have the very real problem that you got somebody pregnant.
How
you
do
know
you
what I mean?
not laugh in this situation?
And then also the question of like, how did your penis even work? Because you've been taking like ungodly amounts of estrogen, but somehow we made it work. You know what I mean?
Okay.
Then we had one that was tough that luckily made it. It's a woman that we're using clearly a dildo that was too big for her and too forcefully. And so, she was doing her thing or whatever, and I guess she got really into it. And though she lacerated everything. So like through her vagina, through her vulva, through her cervix. So she shows up there pale, about to go into shock because she had lost all this blood at home by the time she decided to come in. Like, wow, this doesn't look good. So we go in to do a quick exam with the speculum, right? Like the way you look to say, well, let me see what's going on. And then there was literally nothing I can do. I got close, and all I saw was just this wave of blood coming at me. It was just bleeding, like she was literally exsanguinating right in front of me. So we just put a bunch of packing, ran, took her to surgery, and then luckily
You found the
survived.
goodie.
She survived.
Oh my God.
Psychologically she may have had some damage, but
I don't think she's ever masturbating again.
hopefully not with that same dildo. Somebody came in handicapped for sure. They were using a large vegetable.
Wait, which vegetable?
It was, if I remember, because there's been a lot of vegetables over the years.
What is it with the vegetables?
I don't know. Somehow they're kind of phallic. People think, well, maybe this one will work. Like everything from yucca to apples to obviously cucumber is always the classic one, right?
Yeah.
So they decided that they were going to use a cucumber. I think it was a cucumber, like a large cucumber. And then, between vaginal and anal and this and that, I guess, same thing. They got carried away. And there was a massive laceration that basically just made one huge laceration from her anus to her vagina. So it was just one big cut that was just gushing blood.
Oh
Same thing. So that becomes like a massive reconstruction. Try having that conversation with the gynecologist at 3 a.m. when you're getting him out of bed. Like, sorry to bother you. However, you should probably come here quickly. before this girl dies from a cucumber injury. That's a tough conversation.
Oh
you know?
my God.
But she survived. She survived.
And like, is her vagina and her asshole going to be the same after that, even after reconstruction?
With I never saw her post follow-up, like after surgery,
Oh my
but
God.
if done,
Your job was to keep her alive.
Correct.
Not to make her aesthetically
correct. Job
cute.
done, whatever.
Not for her butthole to be cute for the next man.
But it's surprisingly intricate. If that musculature doesn't get repaired properly, it doesn't come back all the way.
Jesus.
So,
Oh my God. Wait, what about like breaking like a guy's dick? Has that happened?
Oh yeah, for sure.
Can you
That's
fix that or?
You can fix it if it's done quickly, and you haven't incurred any damage to the nerves or to the arterial supply.
But like when it breaks, maybe this is a dumb question. Does it fully come off, or is it just like
It
hanging?
doesn't come off, but like if you think about, because people, people think the penis is a bone. It's not a bone, right? It's muscle. But if it was a bone, it'd make my job a lot easier for a lot of things. But at the office, but it's muscle on the muscle, right? And so when there's a fracture, it usually happens when the girl's on top, and then the angle is wrong, and then it bends a little bit, causes a little fragility on one side, the other side, and it just kind of snaps. The problem is now you have like a massive amount of blood supply under a lot of tension. That's what keeps an erection, right? And then now you can compress nerves, you can damage the arterial flow for the long term. So that needs to be fixed really fast. But we've had a few.
How
of those
long?
over the
How long
year.
is like your time stamp?
Realistically, you have like a
30
few
minutes?
hours.
Oh, okay.
You have a few hours, but like every minute sooner is better, right? Like the more time goes on, the more
Right.
you compress the nerve, the more you compromise the blood supply, and then you might be left with the correction surgically, but that doesn't give you like full erections ever again if there's enough damage. Try living with that,
Wow.
So
Damn.
that's the thing. And those can be, like very, very honest mistakes. Like the times that I've seen those in the ER, like nobody was doing anything crazy. You know what I mean?
Like, do you ask them what position were you in?
It's sometimes you ask. Usually they're
They're like
happy to
telling
tell
you everything. They're like,
Yeah,
fix me.
for sure. They just want to get to it, right? But usually, like traditionally, like statistically, you're a lot more likely to do that when you have a girl on top.
Right, because they're less in control. Like the girl's more in
Exactly.
control. That makes sense.
Exactly.
I also heard that you do injections,
I do.
and I had no idea that you can actually inject the penis to make it bigger.
You can inject a lot of stuff.
But nobody like talks about injecting like a penis. I mean, I guess I get why a guy wouldn't want to be like, by the way, my dick is injected. But like,
Yeah.
how many inches can you add?
So very good question, right? So there's a few different techniques. The most of what you get improvement wise is in girth. But if some of it depends a little bit on the person's anatomy. Some people, based on the type of skin they have, based on the type of collagen that they produce and how they respond, will get some lengthening. You can lengthen like a good inch and a half with injections over time. It's usually more than one set of injections to do it over some time and sort of build it. We use hyaluronic acid, which is the closest thing to like our natural collagen, basically. And so you inject a few different key points to make things thicker. You inject a lot at the base, right at the ligament that sort of supports it. And then as you start to do that, especially if anatomically it's amenable, then when you start to happen is because of the weight, it actually will start to hang more because it starts to stretch the ligament a bit.
Damn.
So there's quite a bit of an enhancement. We inject women too for either enhancement, just like aesthetically speaking, right? Like through the vulva to, plump things up and so on. And then there's some techniques to actually enhance the G-spot.
Okay.
For
For what? More like to be more sensitive?
For sure. So there's a couple of ways to go about it, right? Like there's an injection of something called PRP, which is plasma. Plasma is, your own blood basically that gets spun. Out of that chunk of blood, we get a part that is richer in growth factors, this and that. And then we inject in some key points over the upper vaginal vault and then through the clitoris to enhance, to stimulate more blood flow, to enhance sensation and so on. And there's an older technique. it's kind of fallen out of favor a little bit, but that I've seen do really interesting things in the right candidate, which is called the G-spot amplification.
Okay.
It was it was designed by a guy out of Beverly Hills, if I'm not mistaken, where you actually inject a fair amount of plasma usually and then fillers through the area of the G-spot. So you basically take the G-spot. The G-spot's a real thing, by the way. People think it doesn't exist, but that's you're like, that doesn't exist. It's a myth. No,
You're like,
it's
shut
a thing.
up.
Yeah, it's a thing. Trust me. And then you basically, as you inject it with some skill, you expand it. And so because you expand it, obviously it's an area that's rich in nerve fibers and this and that. And so it makes all the sense in the world that if you do it and you make that bigger, then there's usually like an increase in sensation.
Would it last longer down there or less time?
Good question. Thankfully, it's usually longer.
Really? I would think it would be like a month.
Yeah, no. So remember that hyaluronic acid comes in different levels of viscosity. So what we're able to use for the penis is fairly thick product. And then as you build it over time, it's usually more than one time. So you do it one time, usually we'll wait about 6 months or so until we do a follow-up. When you do the second set and we do beyond, it starts to last longer because now you're basically adding layer on layer. So it's almost like your body starts to form a little extra tissue in response to it.
Makes sense.
So the more you do it, the less you need it in a sense,
Interesting. Like, would you notice that someone got injected?
Oh, it's noticeable.
It's noticeable? Why? Because there's
sure.
like what?
For sure. There's more thickness and oftentimes there's a little bit more length. For sure.
No, but let's say like I never saw the guy and like I'm seeing his penis for the first time. Would it be noticeable?
I see. That you mean like, would you see?
Would I notice that he got it injected?
Right. If done correctly, you would not.
Wow.
You would not.
That's so, I have so many other questions about this. I'm like, who has scammed me in the past? And what does something like this cost?
It's not cheap. It's not cheap. Per procedure, especially with fillers and this and that, usually anywhere from like 5 to 10 grand.
5 to 10 grand, and around roughly how long would it last?
And then, so roughly like 8-9 months. Then the second time will last about a year or two, and then third time a little longer. So the more it gets done, as we were saying, the more you're able to go in between sessions.
Right. And I would assume that this is not something that men feel really comfortable talking about.
No.
No.
There's still a lot of stigma, right? If you think about, for example, like we live in Miami, right? If the hub of, plastic surgery and enhancement and so on, it's a lot easier, for women a lot of times to share, sometimes like women will get, their breasts done, their butts done, this, that, and the other. But for men, there's still a lot of stigma around this other stuff. It's getting a little bit better, the same way that, testosterone use is getting a little bit better, that kind of stuff, but it's still like miles behind.
No, I can see that.
Yeah.
I can see how like it's so socially acceptable for a woman, but like for a man, it's like, the second their face looks a little too frozen, it's like, are you really a man though?
For sure. Sure.
I get the stigma.
Yeah.
Oh my God, that's crazy. But yeah, no, I guess men aren't going to be honest about that. It makes sense. What about injections? I feel like you need to be almost like a therapist before a doctor.
For sure.
Yeah.
Because I am all about, professionally and personally, I'm all about making things better, right?
Yeah.
I think that in every way, right? Like physically, mentally, sexually, emotionally, you should always get up and think, okay, like I need to do this better, do this faster, do this smarter, like all that stuff. So I'm a big believer in it. But can you go overboard? Of course. Do people go overboard? Of course.
It's Miami.
It's Miami. This is the land of opulence.
I'm
and excess,
like
right?
still like excited to see one BBL that doesn't look like a BBL here. I'm excited. Somebody.
I know.
It's insane.
Yeah.
You know what? Actually, my girlfriend got a BBL. And she did it in Colombia. And when she did it, it was ridiculous. It was like too big. It didn't match her legs. It was like, what are we doing here? But then she went on Ozempic and lost weight. And now it's like the best BBL I've ever seen.
Yeah.
So like, I don't know what it is with Ozempic and BBLs, but something's working.
Ozempic is transforming the planet.
It really is. Because like before it was like, sorry, you're fat, too bad. Now it's like all the skinny girls are hating on the girls who can actually become skinny now. They're like, what do you mean?
Sure,
like this was like my thing, and now
there have been like, I'm sure you've met a lot of people like that, but there have been like straight up transformations.
It's insane.
But like crazy.
Like because it like changes your jaw, like it changes everything, not just your body.
No, for sure.
It's
For
insane.
sure.
Do you recommend
I use it for a lot of patients.
for diabetes or just for like weight loss?
For both. I mean,
Okay.
I have some diabetic patients, of course, and then we treat that. But the core of it, for sure, is for weight management and for body recomposition and all
And I
that sort of
guess
stuff.
my question would be, what's the best way to take Ozempic without, dealing with the side effects?
That's a really good question.
Thank you. I'm a
That's a really good
podcaster. I don't know if you
question.
realize.
I see this. I see this. So there's for sure, those compounds work so well that they have lulled a lot of people into this false sense that almost pretty much like no matter what I do, it works and I drop weight, right? The problem with that is, first of all, to your question specifically, the best way to mitigate that is not to go crazy with the dosage, to respect the fact that the dosing protocol is the dosing protocol for a reason. Second, to make sure that you stay well hydrated. People forget that big time. It sounds stupid, but it's a huge thing, right? So if you think about the way that compound works, it blocks your hunger to a large extent, right? So here's the thing. The centers in the brain that control hunger and thirst are basically like adjacent structures. So pretty much anything that cuts your appetite tends to cut your thirst. You forget to drink. And then so not surprisingly, a lot of what you see with people getting heartburn and all this nausea and everything else with those medications usually related to some underlying dehydration. So just doing that alone mitigates like 95% of it. Now, can you still have some people that are really intolerant and do poorly with it and you have to go really slow with the dosage? Sure, everybody responds a little differently, but that's a key. But so the problem with those compounds is, like we were saying before, is that they've, if you do it right and you go on it and you teach yourself how to eat properly, it's awesome, right? Because it's almost like a little bit of like nutritional rehab. If you do it wrong and you say, well, look at this, like I can eat 3 crackers and half a piece of pizza and I'm still losing weight, you're not learning anything, right? So then you come off of it. People ask me this all the time. Well, I'm afraid if I come off of it, I'm going to rebound. It's not really that you're going to rebound, right? But if you think about, if you're eating all wrong, and then you go on this thing and you drop all the weight, but then you stop it and you go back and you eat all wrong, what's going to happen?
Yeah.
Right? Like I tell people constantly, like the drug is not a vaccine against being overweight, right?
It's just to help you.
And it helps you. You're still an adult and you still are responsible for what you're eating. So you got to focus on taking in the proper types of food, even though it's going to be small amounts. Focus on protein, good quality food, hydration, all that stuff, and you mitigate most of those issues.
When you say hydration, how many liters a day?
It's very dependent on your overall demands,
Right.
on how much you're burning, on whether you're exercising, which of course you should be, which not everybody does, on body fat, on body weight, on gender, and so on and so forth, right? But at a bare minimum, I don't like to give these standard numbers because it's highly variable, but like at a bare minimum, you should be aiming for like 60 plus ounces of water a day.
Okay.
It's like a good 8 full glasses.
Okay.
I'd be like, 8 glasses is nothing. But for most people, if they count, they're not drinking anywhere near that.
Especially if you're taking Ozempic, you're really not thinking about it. What about the side effects? Is it true that like your heart gets smaller when you take it?
Anything theoretically, right? Like if the loss is drastic, you can lose skeletal muscle mass. So in theory, we haven't necessarily seen that in practice, but in theory, you can lose muscle and you can also lose cardiac muscle. Right, from just straight up wasting if you go like really hard with the loss. And so the thing is, it's because it's gotten so prevalent. It's almost like people are like, yeah, so and so uses this, I'll use it, so and so, but you could still have some problems, right? What a lot of people don't want to face though is the fact that you could say, look, there's maybe this side effect, maybe this thing, maybe that thing, of course. But the flip side, which is being overweight for the rest of your life, has guaranteed side effects, right? So you have to weigh. And I'm not being an asshole. Like
No,
it's
it's
what it is.
facts.
You have to weigh the benefit.
Did you rather die earlier but be skinny, or be fat and never get looked at?
Good point.
That's basically what he said.
Yeah, I mean, but that's a thing, right? Like people don't want to necessarily face that, but that's reality, you know.
I mean,
so and then I've literally told people this, like, look, nobody here would argue that the best case scenario is that you're at a perfect weight, and more importantly than weight, a perfect body composition, and that you're not on medication. Of course, that's the best, right?
Yeah.
But if the flip side, well, I want to be on medications, I'm afraid of side effects, but then you're carrying 80 extra pounds.
You're like, well, you had no problem eating that burger.
Exactly.
So
your risk
like,
of diabetes is higher. Your risk of heart disease is
Yeah.
higher. Your risk of cancer is higher. Like, those are side effects too from carrying extra weight.
What's the longest amount of time someone should be on Ozempic before it starts getting really concerning? Or is there like intervals of like 3 months, take a break?
You know, we have really, really good data on diabetics, for example, right, that are using it for the long term.
Yeah, because it's been around for so long.
Exactly. So the reality is, if you need to be on it, yes, ideally, if you don't have to be on it, you shouldn't be on it, right? If you're at your ideal weight, things going great, isn't that great? Otherwise, if you're using for weight management, there's a lot of plans now that sort of consolidate the dose. So it's like you get to your target, and then you sort of drop the dose a little bit, or even this idea of like microdosing.
So wait, normally when you're injecting, you're doing it every week once?
Every week.
And then you go from every week to what, every 2 weeks, let's say?
You can do once every 2 weeks. You can just really drop the dose, like on the order of like, 10, 15% of like the normal dose, if you will, and continue doing it weekly, but it's a really tiny amount. And some people argue, well, maybe there's not even so much efficacy physically as much as
mentally, right?
But the bottom line is, at the end of the day, people are like, oh, placebo. Whether it's placebo or not, if it works, who cares?
Yeah.
It still works.
Yeah.
And people are still managing their weight.
Ozempic has been around for so long. Why now, in the last 2 years, is everyone knowing about this? Like, why now? Like, I feel like the biggest thing in Hollywood is like, how do you lose weight before plastic surgery even? Yeah. So why now, in the last like 3 years, is this 2 years? I don't know how long, but like, is this something everyone knows about? Like, if diabetes has been around for so long, why did we just find out that you lose weight through it?
Yeah, so knowledge, knowledge is there, but it's the estimate it takes like between 10 and 20 years from the time like something is known in the medical community to actually become widespread, right? So physicians in general tend to be, by nature, and some of it by legal constraints, tend to be very conservative, right? So they're like, well, this works. Yeah, I've read some papers and I know it works. And they look to the left, they look to the right. Like, nobody's using it in this community. Let me not be the first one, right? In case there's a problem, in case that happens. So there's a lot of lag from the time the data are out to the time people actually start implementing things,
Okay, interesting. Okay. Did you see Lindsay Lohan's new face?
I did.
I want to know what everyone's like, she did a facelift or like she did something completely new. What are your thoughts on that?
So, first of all, I would say refreshing to see
a well-done surgery.
And procedure, whatever it is that she ended up doing. We'll talk about some possibilities because, you see some people. I mean, Hollywood is notorious for that, right? You see some people, and all of a sudden you don't see them for a few years. They come back like monstrosities.
Yeah.
Right? You think, like, how is this possible? You have access to presumably the best, and they're deformed, right? I think she's done a few things. I think she's gone from out to in. She's done a lot of work, which a lot of people have missed, on just the texture of her skin.
Okay.
So she probably has used some radio frequency, some microneedling to sort of open up her pores and make the outers, because you can have the volume and the dimensions that you want, but if your pores are trash,
right,
nothing happens, right? At the same time, you can work on the outer part of the skin and make it glow, but if it's all asymmetric and fucked up, then nothing happens either, right?
Right.
So it really looks like she's done it from out to in. Then in layers, she probably has had a little bit of a lift, but it's been done very gently.
Yeah.
I think that she's had a lot of work with, which is a good thing, with collagen stimulators.
Okay. Is that like an injection?
A lot of it is through injection. There's some machines that will do it, some for lack of better term, some lasers and some Morpheus and machines and so on that have done a pretty good job.
Also, her under eyes are like very like less puffy.
Yeah, which is a tough
That's
area
I
to
feel like
correct.
under eyes is the one thing that even, you know, you go to a doctor and like, we don't feel comfortable injecting this because it
a
might
lot of
create
times you
bigger
make things
pockets.
worse, you know,
yeah.
for sure. And then, you know, I would say, and that for sure, I haven't heard a lot of people talk about. I think that there's a lot to be said. I guarantee you for a better lifestyle. Because she was living hard.
Yeah, she probably
back in
like
the day.
stopped doing drugs, alcohol, and that alone will change your skin.
You can have all the procedures you want, right?
But you're like
if you
treating your
have-
body like shit, like it's gonna show.
For sure, it's going to show. And I think
Yeah.
that was a lot of it because she was still, even at a young age, she's still young, but you know, a lot of the stuff, a lot of that puffiness, a lot of that inflammation, that swelling and that puffiness, that was all from
No, for
some
sure.
self-induced stuff.
Yeah, I remember walking in New York and seeing her eating at a restaurant, and I was like, oh my God, that's Lindsay Lohan. And like, you could tell she just like wasn't taking care of herself. Like now there's, for sure, it's like diet. It's like you're saying, everything she's doing. Also, we got to keep in mind, she's not even that old.
Right,
She's
exactly.
like also like what, 35?
I know.
Yeah. And also Kris Jenner now, they're saying, has done some stuff. Well, she looks like she got the Lindsay Lohan treatment. So
I know, Kris Jenner, never behind an opportunity.
I saw on your page that you talk about fasting. And I was actually asking you before the podcast started, will fasting, you know, if you have cancer, so I have a girlfriend who has cancer, and I was just curious to know if fasting could help with that.
Fasting helps big time. Preventively, like right, as far as preventing cancer and degenerative disease and so on, it's a huge component. The act of fasting, right? So going without, particularly going without carbohydrate, calories, and so on, has been clearly shown to help you basically engage the process of phagocytosis, which is basically that you're getting rid of dead or damaged cells, right?
Right.
It's very well established in animal data. Now I think it's starting to come out in human data as well, that if you restrict calories, for example, in animals, they live longer, which makes perfect sense, right? No matter, at the end of the day, no matter how healthy it is, the food that you might be eating, your body incurs what's called a metabolic cost for breaking down that food, right? There's oxidation, there's free radicals, all this other stuff. So it stands to reason that any protocol, pretty much, and the data show that, where you sort of restrict the time where you put your body under that stress, the better. And there's all these different protocols, right? Like there's like a 24-hour fast, there's a weekly fast, there's, you know, the
3
16
days.
and 8 thing, there's 3 days. And the reality is the evidence there's more and more evidence that comes out. And the reality is that the benefits overall seem to be pretty much with any of those protocols, so long as you do them with some regularity.
Okay.
The longer fasts are interesting, but it can be harsh
On the body.
and they usually, you know, invariably come out with, you know, the loss of some lean muscle mass, because people get older is
yeah.
a very precious resource to retain. So,
Right.
you know, the classic 16-8 kind of thing where you fast, you know, you wake up, because we're like, oh my God, I'll never do it. If I fast for 2 hours, I'll die. Like, well, hold on a minute. You're not going to die, first of all.
Yeah.
You can go weeks without food.
Right.
Right? Most people, especially on this side of the world, go a long time without food. That's for starters. The second component is, you know, if you think about it, like I tell people, look, like you go to bed, you're fasting, right? Like, to my knowledge, you're not, you know, sitting there eating
Yeah.
all bloody night. So that's already a few hours. Wake up the next day, skip breakfast, delay lunch a little bit. You're easily gone to 14, 15, 16 hours.
Right.
That's not that hard.
I think it's more of a mental thing
For
than it
sure.
is
For sure.
the actual act of fasting. So I actually did a fast a month ago
Yeah?
because I don't know if you'll know this, I'm sure, but I'm going through TSW withdrawal, which is the hardest thing I've ever been through in my life. Do you know about it?
Little bit.
Okay, so I grew up having eczema.
Yeah.
And basically, I've been always putting cortisone cream, like whenever I had a rash. And I went through an outbreak where basically the cortisone started not working on me anymore because I needed a higher dose. Yeah. And what happens is when you stop, I guess, cold turkey or like you just give it up. Well, I guess my body was rejecting it already, even on the cortisone. But then I started to go through like a withdrawal. And what had happened is I basically went to see a dermatologist and they were like, just use this cream. And I was like, you sure? Like, I don't know if I should be putting this on my face. And I was like, they're like, just do it 2 weeks and then like stop.
Yeah.
And then what had happened is I went through an insane withdrawal. Like I'll show you pictures, like the scariest thing ever. I'm still dealing with it. So I basically took to like me doing my own research, and I was like, how do I cure this faster? How do I get out of this uncomfortableness? Because it's shedding. It's like, I feel like an alligator. Like it's the most uncomfortable thing I've ever been through. And it's more or less 2 years I'm dealing with this.
Man.
So I did a fast about a month ago. And then when my skin cells regenerated, I saw a little bit of a difference.
I can see that.
So now I'm like, okay, well, I did a 3-day one and I saw a little bit of a difference. Should I continue to do next month like a couple of other ones? Should I do 5 days instead of 3 days? Because I guess like once you hit the 3-day mark, you're already in like autophagy stage where like your bad cells start to eat, your good cells start to eat your bad cells.
Yeah.
So like, would you recommend doing a 5-day one, doing one per week? Like, I just want to get this over with.
Yeah.
I'm exhausted. I also took cyclosporin. I don't know if you know what that is.
For sure.
You're like, yes, I'm a doctor. And that actually helped me get through the most difficult time.
Yeah.
But then my doctor didn't want to keep me on it for longer than 5 months. So now I'm dealing with the rest of it. But it's never gotten as bad as that stage when I took it.
There is not one hard set, well-established fasting protocol for what you're dealing with. However, exactly as you said, I wouldn't recommend more than like a 2 to 3 day fast.
Okay. So 5-day no, if I did one?
I don't think the added benefit outweighs the negative.
Okay.
I think you're better off doing at most 3 days and maybe even shorter, like a 24-hour fast every week or two.
Okay.
I think will carry you further with less stress, especially if you've done like longer fasts. Your body sort of learns to enter in that state
Quicker.
more efficiently, right? So even if you do consistently, it doesn't even have to be every day, but if you do like 4 or 5 days a week, like a 16-8 fast,
Okay.
still plenty of time to do it on a recurrent basis, and that comes with a lot less physiologic stress. You got to remember, women in particular are more susceptible to some hormone derangements from longer fasts. So men will tolerate it a little bit better usually.
Oh, interesting.
So does it happen to every woman who does a long fast? No, but you're a lot more likely for that to happen once you start to push. And ultimately the benefit past 2 to 3 days really is like marginal at best.
Oh,
So is it
really?
really worth the added stress? I'm not so sure.
Okay, so I'm better off just basically eating at 12 and finishing around 6, 7, and then calling it a day, stop eating,
Exactly.
and then just do that for like a month and see, and I'll see a difference, you think, in
will.
my skin cells regenerating.
And that's multifold, right? Like the idea of the fast is, think about it this way. Number one, you have this idea of autophagy, for sure. Number two, it's an anti-inflammatory component. So you have a stimulation of your growth hormone production, you stimulate growth factors and all this other stuff. And number three, which often doesn't get talked about with pretty much any fasting protocol, it's not only about the fast, but the fact that you're also eliminating, by having that window, you're not consuming anything. The fact of the matter is you're eliminating the possibility for introducing more stuff in your body. And so just eliminating stuff a lot of times is actually very beneficial, you know? Because let's face it, most of the stuff that we're exposed to, even if we try to take as much care as we can about what we feed ourselves and everything else, especially in this part of the world, most of the stuff that we're exposed to is crap.
Yeah, because the thing is I've done my research and a lot of people have said, you know, this is like a withdrawal you're going through, and regardless whether you remove gluten or dairy, like it's got to come out of your system, and you can change all of that and it still won't change anything. Yeah. So it's like, it's so hard to figure out, like, I mean, I changed my diet because I'm just trying to speed this up, but like, it's hard to kind of say like what works, what doesn't work. And like, I'm just assuming like eating healthier is better, but like, is it really helping the steroid? I don't know.
Yeah, because there's two components there.
Yeah.
The withdrawal component, and then ultimately you still have something or some things that may be triggering that reaction in your skin. Right?
Yeah.
Because you think about, you know, whatever is going on in your skin is a manifestation of what's going on inside your cells, right?
Right.
And so the challenge a lot of times doesn't always get answered, but the challenge a lot of times is to try to find the cause. So of course gluten gets thrown around because, you know, it's a thing,
Yeah.
and it is a thing, and gluten's a toxic molecule. But it could be a lot more things than that. It could be some kind of food intolerance. It could be like a straight up allergy. You can have some autoimmune things. It may very well be that it'll sort of just go away, and then in 6 months it'll be a distant memory, never come back, and you'll never know why.
Yeah. I
So
would say
long
I
as-
probably have 3-4 months under my belt left. That's just me like seeing like the state of like each month and where I've been. But there was anxiety being on cyclosporin because I'm like, when am I going to get off here and be a reptile again?
sure,
Like,
for
it's
sure.
like the stress of that is like, maybe let me just do it naturally at this point. Cause like what's going on, you know?
Wise move.
Okay, so that's interesting. So I'll continue. I'll do like I don't know. I'll still maybe do like a 3-day fast every once in a while. But
Yeah, nothing wrong with doing like 2-3 days. I'm not, in general, I'm not a big believer of like much longer than that.
Okay.
Because I think it's just ultimately too much, especially if you're going to do it with some recurrence. I think for most people, it ends up being too much physiologic stress that doesn't necessarily translate to more benefit.
Okay.
Like past 2 to 3 days, realistically, you're going
Yeah.
to lose some lean muscle mass. You're most likely going to cause some dysregulation in your hormones.
yeah.
And then the added little bit of extra autophagy that you might get from it, I don't think is really worth it.
Okay.
You know?
Good to know.
Yeah.
Okay. I'm happy to learn that. I've been dying to ask. So this is perfect. Do you think that Botox prevents wrinkles?
Totally does.
Let's say like you're 20 and you're like, I want to get it now so that I prevent it from, I guess becoming worse.
For sure, that's a thing. If you think about how Botox works, right? Botox relaxes the muscles. So how do we form wrinkles? We form wrinkles because of repetitive movement across muscle fibers. Well, anything that over time prevents or at least slows down those contractions is going to stop or slow down the amount of collagen that you lose in between those fibers. So over time, if you do the whole idea, without exaggeration, obviously, but the idea of doing a little bit over time before you have wrinkles actually will prevent them from forming at all, for sure.
What age would you say around a woman / man should start? I guess it might not be the same age.
It's not the same age, but on average, I usually recommend mid-20s to early 30s at the latest, just to do little bits. Have I seen people, I was like, oh, there's exceptions. Of course there's exceptions,
Yeah.
right? Like we've all met a 4-year-old who's never had anything done and has nothing.
Like
Sure.
J-Lo. Like she's still
Right.
lying about that shit. It's insane. Because she pops olive oil on her body and suddenly she's a goddess. Like,
Right.
girl, just be honest.
I know.
I don't know.
J-Lo lied about some other stuff.
What else does she lie about?
You know,
She's definitely got a facelift, J-Lo.
there's some stuff. I mean, no doubt.
What do
that
you
she-
know? Spill the tea.
No. I don't know specifically, but I mean, she's at an age, right?
Yeah.
But to be fair, she also seems like she takes really good care of herself.
No, for sure.
And that cannot be understated.
Absolutely.
And undermined,
I think that's what she fears is like people are going to discredit her actually like, aging youthfully because she did a couple of things. And it's like, trust me, there's people who are 60 who still don't look like you. Don't worry. No one's thinking that.
Exactly.
But do you think that celebrities should be honest about what they get done?
I think that they don't owe an explanation to anybody.
Okay.
We see that with aesthetics. We see that a lot with the men and hormone questions and everything else. And like, oh, I know he did this. Like those are the haters. They're like, oh, I know he did this. Okay, and
Yeah.
so what?
Yeah.
Right. Like he's not being drug tested. A
Right.
professional athlete,
Yeah.
subject to USADA and WADA. Let them do whatever the hell they want.
Yeah.
Make their living off of it. Do it intelligently. I'm not saying people should do whatever at all times. That's not what I'm saying at all. But I think they're entitled. If they're, people are entitled to make their own decisions.
Yeah.
So I never get hung up in those questions for the simple fact that I don't think they owe anybody anything.
Okay.
You know,
Fair.
if you want to use ungodly amounts of stuff and do a bunch of stuff to yourself, try to do it as safely as you can.
Yeah.
And if you don't want to do anything, don't do anything.
Yeah, let's talk about butts for
All right.
let's talk about asses.
Uh-huh.
Okay, so you can do a BBL that sometimes, I mean, most of the time in Miami, I'm like, this looks horribly done.
Mm-hmm.
Or you can also inject. Would you say injection is more natural but costs more? Like, what's the vibe on that?
I love injections
Yeah.
for the butt for a lot of the reasons that we were discussing before. I have never, ever, either professionally or personally, seen a BBL that looked perfect and natural. Never. It always looks a little unusual.
Yeah.
Because, like we were saying, even before we started filming, the fact of the matter is it's usually not well matched to the size of the legs.
Yeah.
And so that's usually the telltale sign.
Yeah.
They usually come off either a little too squarish or too round in proportion to the rest of the body. And let's face it, it's an invasive procedure. So contrary to injectables, like you can't say, well, next week we go back in and do more, and then 2 weeks from now we reoperate. Can't do that.
Yeah.
You got to make some decisions when you're in surgery. When you do it with injections, yes, you have to do it over time, so it can get a little costly. For sure.
Yeah, how much are we talking? Obviously, depends the gaps and the holes we're filling, but
Correct. It'll run you easily like a good $3, $4, $5 per session.
And how long do you got it? Like, how many times do you have to be back in your office?
Every 6 months or so.
Right. So it's about 4 or 5 Gs every couple of months, like 6 months.
But, downsides, right? Like no downside as far as, I don't know if you've ever seen anybody recover from a BBL.
Oh, it's insane.
It's a gruesome stuff, right? You do a set of injections and you're a little sore for a day or two. But
and also you can see if it's like if something you want in the future, right?
Exactly.
It's not like you're stuck with it.
You're not.
Like, how do you reverse a BBL? Can you go back to your original?
Between all the scarring and everything that you have to go through
and the stretch
remove
that
this and remove that, you really can't.
Interesting.
Not the same. Like surgery is a big step.
Yeah.
Surgery, once you say, listen, I'm gonna alter this with a knife.
Yeah.
Holy shit.
What's the biggest, like the most popular surgery for a woman?
At this time, still, I think worldwide, if you look at the data, is still breast surgery.
Okay.
Breast and lipo. And the techniques are forever changing, and they're getting less invasive, and they're getting more creative. Plastic surgeons are never short of on ideas and egos,
Never.
Right? So,
well, now that you're telling me they're injecting your penis and your G-spot, I'm like, dude, there's really just nothing left.
No,
there's nothing left
limit.
real in this
There's
world.
No limit. No,
Everything is fake. It's all an illusion.
Everything's enhanced.
Oh my God.
You
Let's talk a little bit about having sex.
All right.
You're like, okay. Let's talk about men for a little, because I know maybe, men here listening, are maybe having sex and are maybe a little bit nervous or they want to last longer. Mm-hmm. What are some natural kind of, I guess, ways to last longer in the bedroom?
So from the simple, this is an age where there's so many recommendations on
Viagra,
Viagra, and exactly, like medications, this, that, whatever. Sure, and we're going to talk about that. But simple things are still a thing, right? The two key factors above anything else: be physically fit.
Okay.
Do your cardio, lift weights and all that, sure. But the most cardiovascular resistance you have, the more your arteries are amenable. And the more fitness you have to it. You don't want to be the guy heaving in and out.
Yeah.
And being done in 30 seconds because you can't breathe. That sucks. That's number one. Number two, don't drink alcohol, or at least limit it.
Okay.
'Cause that's a thing. People think that it's a great social lubricant. And
they're like, I'm so nervous. What if I drink before? I'll be like ready to go.
Yeah, exactly. But I'm telling you, it's not, a little bit of alcohol here and there, no problem. But there is past the point, right? Like the term whiskey dick is a thing, right? And it's not folklore, like it's a thing.
Yeah.
So alcohol is a big performance.
That's a good point.
Problem. Feed yourself properly. Glucose is a killer of erections and stamina. So not saying everybody has to be like the Liver King and hard, just eating raw liver and raw kidneys and bone marrow, whatever, but feed yourself properly. Not a lot of processed foods, good quality proteins, high quality and high intake of good fats. That's a huge component because that boosts testosterone production. It basically puts your body in a state of plenty, mentally even. And so that a lot of times helps to mitigate a lot of issues that are related to like anxiety, that kind of stuff, right? There's some supplements and some things that can be quite helpful. There's a supplement called citrulline, which is very interesting, that helps to enhance flow. Magnesium helps relax arteries. So as you relax arteries, you tend to fill arteries a little bit more, which is very, very helpful. There's some supplements out there that have been pretty interesting to boost testosterone production, erectile function, something called Tribulus, which is like an old-fashioned supplement.
Okay.
It does a pretty good job. Again, like manage stress. So like anxiety and performance anxiety.
Everything's always linked to stress at the end of the day.
Sure.
It's like crazy.
For sure. But that's a key thing. I've never been a huge fan of, these techniques about, count the dots on the wall or like whatever, because then it's almost like you're disengaging yourself from the process.
Right.
So it's like, you last longer, but you're not really into it.
Right.
What the hell's the point?
Yeah.
Right? To be like, oh, tomorrow I got to do laundry, whatever, when you're like going
you're like trying to tell yourself, like, don't come.
You know what I mean? Like, we've all done it at times. I'm not saying, but it's not the optimal, right?
Right.
I'm telling you, like, physical fitness, do your Kegels. That's a thing, too. We think Kegels are only for women. That's not true.
Really? I thought it was only for women.
No. The more you learn to control your perineal muscles, the better that is for erectile function, for erectile frequency, for erectile intensity.
And your dick cracking.
Exactly. That too.
What about for women, in terms of like making sure like, it's clean down there and it smells good? Is there certain foods or anything that can help with that?
Pineapple always gets thrown around.
Yeah, it does.
Right? For both men and women.
Yeah, for like men's semen.
For sure.
Like for it to taste better.
Yeah,
is that like a thing, or is that actually true?
It's hard to discern. Like, are there a lot of, like medical studies on it? No. But, when something makes its way so deep into folklore, there's a reason why. You know what I mean?
Somebody really did the test.
For sure. For sure. So, trust the source, I guess,
Yeah.
And then, for women, for sure, pH issues are a big thing. Quality of nutrition is a big thing. And like I always tell people, like, look, you're an adult, like you're responsible for for your hygiene and all this other stuff.
Yeah.
It still has to be said, which is crazy to me.
It's insane.
But that's a thing.
Damn. And I guess let's talk a little bit about like being sexually active and like not using condoms. Like people, like there's obviously a lot of stigma around, getting STDs. Like, what can you say to anyone who has an STD? Because I have got some comments about that. Like, what do I do? Like, how do I tell my partner?
Wrote that book. There's a book called Uncomfortable Conversations. It's not specifically about STDs, but it's a really good read. And basically it talks about the idea that the quality of your life is largely related to how well-versed you are at having uncomfortable conversations. I'm just going to throw that out there.
Yeah.
It's an interesting time, right? Because for a long time, I feel like a lot of people got this idea entwined that wear a condom because of HIV. Almost like nothing else existed.
Right.
Everything else, people had the idea of, it's just a shot and then it'll fix it.
Yeah.
Well, that's not true, right? Because herpes is forever.
Yeah.
And some of the other illnesses can cause a lot of stuff. But so because there've been a lot of advances in the management of HIV, right? So HIV, for a large extent, if managed properly, has really been reduced to like a chronic illness, right? So we have now a lot of evidence, people that have lived with HIV for years and years and years, they're doing perfectly fine on treatment, viral loads of 0. They're with long-term partners that don't use condoms, and there's no conversion of the partner
really?
and all this other stuff. So that's all great advances, but I feel like out in the community, a lot of the message that's been received has been, HIV isn't really a thing anymore, so I can just go without a condom, right? The problem is that, number one, that's not completely true because you could still catch it. Number 2 or 3, whatever number I said, all the other illnesses are still out there, right? So like we see on an ongoing basis spikes in syphilis, in gonorrhea and chlamydia and all this other stuff. And some of them, sure, if you get it early and you treat it and this and that, can be easily treated and resolved. Some of those things will stay with you. Some of them cause really weird symptoms that sometimes don't get picked up right away and all this other stuff. So you got to be you got to be responsible for yourself first, and then do the right thing. If you have something, if you catch something, if you know of something, call people. It sucks. Yeah. Is it a
Yeah.
pleasant conversation? No.
Yeah.
Are people going to curse at you? Very often.
Yeah, for sure.
But it needs to be done. Like, it's part of being an adult. Sometimes you got to do what you don't necessarily want to do because it's the right thing. You know?
Yeah. Yeah. Okay. Is there anything else like you would want to talk about?
We covered a lot more than I thought we were gonna.
Yeah, because you're great. You answer, but you don't go like, you have like good EQ.
Thank you. I pride myself on that. I'm always trying to, like, I have 2 kids, right? They're a little older, like teens and old, and you know, and I always try to tell them that conversation, not only for girls, but like in general, it's like ping pong.
Yeah.
Right? Like, you hit a ball, and then you got to wait for the ball to come back. You hit a ball. You can't just keep 9 balls in your pocket and run away. That's not a conversation. You got to be able to
100%.
do this kind of thing.
I want to thank you so much for coming on today. This was so fun. You are so easy to talk to.
Thank you.
And I will definitely have you back on.
Let's do it. I look forward
Guys,
to it.
comment down below and ask what you want to hear next. So thank you.
You're listening to the X Podcast.